This is the pharmaphorum podcast. My name's Dominic Tyre, and I'm pharmaphorum's creative and editorial director. This special episode is sponsored by Exevo and features digital transformation leader Edwin Erckens. Omnipresence by Exevo is a unified and intelligent customer experience management platform for healthcare and life science organizations. It combines CRM, omnichannel engagement, advanced analytics, and AI capabilities into a single unified and intelligence platform. Now, even though he is currently working in the HR services sector, Edwin started his career at P&G, moved to Heineken, and then held regional and global executive IT and digital roles for around 8 years at top pharmaceutical companies such as Teva and Sanofi. In this episode of the podcast, he talks about the meaning of digital innovation, both inside and outside of pharma, organising companies around digital innovation, and how to develop a digital strategy in pharma. You can find more details of this episode, including a download link for the podcast and information about other instalments in the series at pharmaphorum.com/podcast. The Pharmaphorum podcast is also available on iTunes, Spotify, Acast and Stitcher, where you can find and subscribe to it by searching for Pharmaphorum. Edwin, welcome to the Pharmaphorum podcast.
Hi Dom, how are you?
Very good, thank you. So I'd like to start off with getting your thoughts on what digital innovation means to you.
Well, it's actually a very difficult question, but I think we're about to turn into a time where we just call it innovation, and I think it's all about multifunctional innovation for me.
It certainly seems then that we're moving past that sense of digital as a separate thing that you put in a box and it lives over here, but it's not part of the organization. It's not necessarily a core part of everything. Do you think that's a change we're going through?
Absolutely, yeah. It's like digital cameras are not called digital cameras anymore, right? Of course, there are still non-digital cameras, but the vast majority is digital. And I think any innovation really has a data or technology, i.e. digital component nowadays. I can't imagine any breakthrough innovation without it.
Absolutely. So, and in terms then for pharma, what do you think digital innovation, or just innovation, what does it mean for pharma at the moment?
Well, obviously, pharma is an innovation industry, right? It's always been driven by creating scientific innovation in medicines. I think that is going to stay, right? Now, obviously, a lot of that is supported by new ways to do modeling and computing and analytics, and all the innovation, all the research is highly supported by data and digital tools. But apart from that, apart from the R&D, the typical scientific R&D and development, I think it means that in the commercial space, in finance, in supply chain, in manufacturing, it's really all about multifunctional innovation, right? You cannot do innovation in a function or in a silo anymore. And that's true within the company, but also externally. I don't think pharma companies can really do breakthrough innovation. I mean, breakthrough innovation in the business models without working with other companies, other partners outside of the pharma industry.
And in terms of that need for work to be multifunctional, how do you think companies should look to achieve that? I mean, how could they organize themselves to be really laser guided, focused on innovation?
Well, that's the big question. And what's also important is innovation, I think, is not the issue. So I think there's a lot of good innovation, a lot of smart people in the industry. There's a lot of creative ideas. I think that the challenge is how to scale innovation. And that's really the challenge. And how do you organize to scale? I think in pharma, you run into a dilemma because in a way you need scale on a global level, you need scale from an investment level, but that's also where two of the biggest challenges are. I think one is the fact that when you need to invest, besides your traditional investment in research and development for new medicines, where do you put the money, right? So scale, where you can't afford to not invest in R&D, and when you invest in new business models, in real breakthrough digital innovation, how do you get enough money invested with a very unclear return on investment often, and margins that are much lower? The second challenge is that I believe in healthcare, so that's not limited to pharma, but in healthcare, obviously there are a lot of things to fix, to improve, and I think the COVID period makes that even more apparent. But the challenge is that the innovation requires partnering of multiple instances in typically in a country, because the healthcare systems are very different, and you would need healthcare providers, insurance companies, maybe tech companies, pharma companies may play a role. You need to find a way to make that work in a specific healthcare ecosystem, and they're very different. Even within Europe, the way it's organized in the UK is very, very different than it is in the Netherlands or Germany or France. Let alone the differences between countries like China and the US. Now, the challenge is to make it very relevant, do innovation in that ecosystem, and at the same time get to scale. And you need scale because otherwise you can't get the investments and basically the attention of management and the shareholders to do it properly.
And within that, when companies are looking maybe where they put their money, what different types of business models they might be investing in, also their global priorities and the differences within the different countries that they operate in. Do you have any suggestions for listeners when it comes to how they might approach developing a digital strategy in pharma?
Yeah, I think the only way to really create breakthrough innovation is to partner with, in the case of pharma companies, to partner with insurance companies, because somebody needs to pay for it, and obviously work with the healthcare providers. And there are countries that are a little bit more centrally organized than others, like China, where you really see that work with the companies, insurance companies like Ping An, working with the healthcare providers and the pharma companies and other tech companies to really transform the healthcare business model. And in this case, in China, for example, that's where you see the speed of telehealth, really online doctors and real digital models to scale and improve the healthcare for patients really fly compared to other markets. So it's really that working together in partnership, which is difficult, right? Because who's going to make the investments, who's going to make the money, who's going to have the intellectual property, and it's different in every country. But you have to start somewhere, and sometimes it's easier to start in the emerging markets than to start in mature markets. So my suggestion would be, try to start in emerging markets, because that's where you see often the greatest innovation, because the need is very high, but the interest and willingness of the different partners is higher in those places.
And would you also potentially see fewer legacy models, fewer models where where things have always stayed the same in emerging markets, if they're a little bit faster moving, perhaps?
Yeah, I mean, of course. I mean, there's the need is higher often, and that makes people more creative and more willing to try new things to improve. And obviously, some of these markets are huge, right? I mean, when it comes to patients, but also healthcare issues, the opportunities are huge. And yes, I'm not saying it's easy, not at all. But what I've seen, and I've seen many great, ideas and really fly in India, in Russia, in China, Brazil, Chile. Many of these markets have very serious healthcare ecosystem problems, if you will, but find very creative ways to find solutions.
So, of course, you've worked both in pharma and then also for some time on the consumer side as well.
Yeah.
How successful do you think pharma's current digital strategies are? If I could ask you to judge them.
I don't think they are very successful yet, because it's very difficult to define one global digital strategy. I haven't really seen it. I've seen many ideas, but obviously a strategy is not just a nice idea, right? It's there needs to be a real plan behind it and a real business model that is profitable in the end. And I haven't really seen it yet. It will happen. Um, my expectation is that, especially around integrated care, so integrated care for patients, so the combination of medicines and other forms of care towards patients. I mean, that's, I think, where the real breakthrough could be. Again, it will be different per country, but that's where it will come from. The question is, who's going to pay for it, right? And ultimately, I don't think you can, in 10 years from now, I don't think you can sell pills without services around it. So it will happen. The question is, is really when. So I think the ideas are there, but I wouldn't call it a real, I don't think there's really clear global strategies. I haven't seen it yet.
Is there anywhere that pharma typically maybe goes wrong or makes a bit of a misstep when it comes to developing a global digital strategy?
No, I think it's really comes back to two things, right? Their traditional business is still very profitable, and it's very difficult to add something to it that has a margin, profit margins of at least 20-30%, and has the scale. And then you also deal with the fact that digital innovation will typically vary per market, per healthcare ecosystem. And therefore, it's very difficult to have one single simple digital strategy like you could have in other industries, where the markets are more or less the same and the products are the same. The physical product in pharma is typically the same, but the ecosystems are very, very different.
And in terms of maybe adding something to what pharma currently does, you've mentioned already, of course, the importance of having a strong partnership approach. But is there anything else, do you think, that pharma can do to stimulate digital innovation?
Well, I've like you already said, I worked in consumer goods before, and I really believe that innovation is never done in a lab or in an office or nowadays at home. I think innovation is always done very, very close to the consumers or patients in this case, or healthcare professionals. And I think the industry has talked about being patient-centric for decades, but compared to consumer goods companies, I think they're far away still from patients. And I think the trick is to be really close. And there's always this worry about ethics. This is a worry about talking to patients, although I think it's not really based on any really strong arguments. I think everybody can talk to patients, and most of us are patients in one shape or form, and suddenly we all become patients at one time. So I think really understanding how patients think and work and live, I think that's the trick. And also just look at the way consumers deal with digital changes, right? It's not necessarily innovation, but digital changes. I always look at my kids and my parents to see what's possible and how things work. So bring the outside in, and don't try to always complicate things. I think just looking at patients, at people, at consumers, observe them through panels or visits or whatever, and bring that in, and don't try to complicate things or start with the assumption that pharma or healthcare is different, because it's just all about people and change.
So if that's what pharma companies need to be doing, what they need to be considering, how about what they're already doing or they've already done? Do you have any examples of approaches to digital innovation you've seen that have really worked in pharma?
Yeah, I mean, I think there's an enormous amount of innovation happening, and I've seen really great innovation both internally and externally. And so there's a lot of innovation around patient support, for example. Patient programs used to be very much nurse-driven, and nowadays I think they're highly driven by digital solutions, and customer relationship management is broadly used to manage relationships with patients that are in patient support programs. So I think there's a lot of innovation there. It's not always visible to the outside world, and it's not, or it's certainly not branded. So it's sometimes hard to see that from the outside. But I think there's a lot of innovation going on. Obviously, there's a lot of innovation in devices, connected devices, and clearly that will be the future, right? I don't think there will be many medications in the future that don't have a device with it, right? Either to stimulate adherence or check safety or just help with the administration of the medicine. So lots of innovation. I think the trick is always, how do you scale? And I haven't seen massive scale. That's the real challenge for the next couple of years, I believe.
And you mentioned CRM there. Another area that many pharma companies are looking to innovate is how they engage with their customers. In terms of trying to improve, to innovate that area of the business, what do you think pharma companies need to be doing there?
Well, obviously the model is changing. Surprisingly, I think for many people, it's still an industry that is heavily dependent on large numbers of sales reps. It's still a fairly traditional model, and in the last couple of years, the last 10 years, I would say, there's been a lot of innovation in CRM to make the sales force more efficient, right? Make them more effectively, more efficient. And I think a lot of investment was done. If you look towards the future, and it's now accelerated by COVID, is that the model will be a hybrid model where the customer engagement, so the healthcare customer engagement and the patient engagement, will be central, and the sales force is a channel. And it's hybrid in the sense that the person-to-person relationships will still be very important in the future, simply because the value of information typically depends on the trust that you have in the person or the organization that supplies that. So the relation and the trust continue to be very important between sales reps and companies and healthcare professionals. But on the other side of the spectrum, we'll have an expectation for great experiences from a healthcare professional point of view, but also from a patient point of view. And a lot of that will have to be automated, or at least will be omni-channel and needs to be orchestrated. So both models will live together, and that's what most people would call a hybrid model that we're moving into. So it's CRM is traditionally was more Salesforce automation. It now becomes real omni-channel engagement. And it's not new, it's not specific to the industry. I think the industry is late. But the good thing is that obviously there's a lot to learn from other industries. And what you see in with COVID now, it's accelerated, and most companies were actually very well prepared and can now build on the innovation, or at least the perceived innovation, and get even more out of what they already invested in the many years. And at the same time, what's also important is that the cost of the sales force and the investments around it are extremely high, and there will be a need to spend more money on marketing and other channels. And I don't think the total commercial spend will increase, will rather be reduced. So there needs to be innovation and cost saving at the same time.
And I suppose it's never too late to start innovating. There's never a point at which you say, no, I don't want to make progress. I don't want to change things. There's always time to make changes, isn't there?
No, sure.
So we've spoken about partnerships and the need to scale, and a great look at digital strategies. Just to conclude this episode of the podcast, and I'd like to get some final thoughts from you, Edwin, around what advice would you have for pharma companies that want to make more innovative uses of digital technology?
Well, I don't think it's specific for pharma, but I think it's always super important to be externally focused and bring the outside in. And that means look at the way consumers deal with digital technology, look at the way healthcare professionals use digital technology at home or in their practice, but also bring in employees from other industries, work with vendors that are not limited by their experience in healthcare or pharma, and try things and celebrate and learn from failure, which is not, I think, the often the nature of pharma companies, for good reasons, right? Because quality and safety is always a high priority, but in many cases the risk of trying new things is not so high. I mean, so try things and don't try to overcomplicate it, and don't always believe people that things in pharma are different, or that regulation stops us from innovating. It's just not always true. And be bold, because I think the world needs innovation, right? I think the world needs a lot of healthcare system innovation, and everybody who works in healthcare, I think, has the opportunity to contribute. So keep trying things and scale.
Well, be bold, try things, and scale. They certainly seem like words to live by in terms of digital innovation. But Edwin, thank you very much for joining me on this episode of the pharmaphorum podcast.
You're welcome. It was fun. Thank you.
And that concludes this Exivo-sponsored episode of the pharmaphorum podcast, and my discussion with digital transformation leader Edwin Erckens about digital innovation and strategy. You can find all the details for this episode, including a download link for the podcast and information about other installments in the series, at pharmaphorum.com/podcast. And to learn more about omnipresence, be sure to visit exivo.com. The pharmaphorum podcast is also available on iTunes, Spotify, Acast and Stitcher, where you can find and subscribe to it by searching for pharmaphorum. And don't forget to visit our website to sign up for daily or weekly email pharmaceutical news and analysis bulletins, and follow us on Twitter, where we are at pharmaphorum.